Let's talk about the first disciple of menopause, hot flashes. It is the most common symptom during the transition period from when you are not fully menopausal, but you're on your way to becoming menopausal. And studies show that it occurs in up to 80% of women, but only approximately 20 to 30% of women seek medical attention. These symptoms can range from mild to severe, but they are by far more common during that menopausal transition and early post-menopausal period. When hot flashes occur at night, we call them night sweats. So hot flashes can last from 2 to 4 minutes each time it comes, and there's associated profuse sweating and even increased heart rate. Heart beating really fast. Sometimes also women feel chills and shivers, and many women talk about anxiety and they feel really anxious around this time and they have the hot flashes. Like I said earlier, it can last from 2 to 4 minutes when it occurs, and it can occur several times a day. It's usually more common at night. So hot flashes stops within a few years of onset in majority of women, but in a few women it can last as long as 20 years. Sorry, I hope you don't belong in that category. Some studies show that it interferes with sleep in 94% of women. It interferes with concentration in 84% of women. It interferes with energy in 77% of women. Interferes with sex in 61% of women. And in a study of 4,440 women that are post-menopause with moderate symptoms, the year previous, about 11% of them missed work because of hot flashes. Disciple number 2 of menopause is night sweats. Now, night sweats can be very, very distressing, and it comes and goes. It lasts for a few minutes at a time, and then it goes. But the problem with this disciple of menopause is that it's a Liverpool Football Club fan. It must never walk alone, because there are so many other diseases that can cause night sweat, and they're usually severe diseases, dangerous diseases. So in the next video, I'll go through diseases that can cause night sweat. If you have night sweat, you must make sure you have other menopausal symptoms together with it before you can say that night sweat is from menopause. So quickly, we'll go through other causes of night sweats, because many other things can cause night sweats. Cancers, this is the big one. Cancers cause night sweats, but with that there'll be weight loss and fever. Tuberculosis, HIV, malaria, typhoid, sepsis generally, all of them cause night sweats, so you have to rule that out. Pheochromocytoma cause night sweats, but there'll be headaches and tachycardia with that. Carcinoid syndrome causes night sweats, but there'll be flashing and diarrhea. Insulinoma causes night sweats, but with that there's weight gain and low blood sugar. Acromegaly causes night sweats, but there you have headache, you have bone and soft tissue enlargement. Autonomic dysreflexia, usually associated with injury to the spinal cord. So these are other causes of night sweats. Not likely, but possible. The third disciple of menopause, which is irregular periods. Not a good symptom. Now, with irregular periods, you may have less frequent periods, more frequent periods, heavy periods, delayed periods, absent periods, then present periods, or altogether just very, very erratic. And it is when you've had no periods for 12 straight months that we declare you as being menopausal. But the journey to this menopausal thing can be very treacherous. That is partly because these periods, especially the heavy periods, can cause anemia, which is loss of blood, especially iron deficiency anemia. And when you have those, you become really, really tired. Now, there are treatments like hormone replacement therapy or the use of tranexamic acid. But first, before we give you those treatments, we would like to do a uterine biopsy to make sure you don't have endometrial cancer. Painful sex, vaginal itch, and vaginal dryness. Vaginal dryness and vaginal itch are both caused by decreased estrogen. At this point, the estrogen is not well produced, and decreased estrogen causes reduced vaginal lubrication, which in turn makes sex uncomfortable and painful. It also makes the vaginal tissues thinner, less elastic, more stiff, contributing to pain and discomfort during sex. The decreased elasticity caused by less or lower estrogen levels also make the vaginal walls less stretchy, more rigid, and this causes pain during penetration. On top of the underlying anxiety and stress and decreased libido, this makes sex generally an undesirable activity at this point. point. So mood swings, mood irritability, risk of depression and anxiety higher. This is the most vicious disciple of the menopause, in my opinion, especially not just for the person going through it, but for people around the person going through it. It is easy when someone is mean all the time. You can kind of, prepare for that. But when you're going through menopause with mood swings, today you're very nice, tomorrow you're mean, and then you're nice. It makes it difficult for the person next to you to adjust. But this can be treated as well with hormone replacement therapy, with some antidepressants. But it's a very, very bad symptom, and I really feel bad, and I hope that women are supported. So we're talking about sleep problems, difficulty falling asleep, difficulty staying asleep. It might even be difficulty initiating sleep, and this is often due to night sweats or other things like the mood problems. But whatever it is, if you don't sleep well, the next day you're tired, you're irritable, it makes your day less productive, and this can cause problems at work. It can cause problems with your relationship. It just generally makes you miserable, frustrated. Some people have described even being suicidal because they can't do anything. Any small thing, they are tired. But we can address this. So hormone replacement therapy, sleep hygiene, sleep aids. See your doctor. Breastfulness disappears, the breast changes in size and shape also. Sometimes the woman feels like the breast is actually bigger because there's breast engorgement because of all the hormone changes going around. There's also breast pain, and it scares women a lot when they feel breast pain. It's important around this stage that you go for your annual mammogram. We want to make sure you don't have breast cancer, just to rule that out of the way. But there are things you can do. If you're worried about the breast becoming more flat, becoming smaller, you can augment your breast when you go out. You can also do a breast implant. You can do platelet-rich plasma injection into the breast to lift it up. Discuss with your doctor. And the ninth disciple is memory and concentration issues. So menopause causes a lot of forgetfulness, wandering thoughts, poor concentration, memory issues, concentration problems. And this is partly because of the hormone problems going on, the lower estrogen, but also because of other underlying problems. So people are tired because they've been bleeding a lot, so they can't focus, they can't concentrate, there are a lot of mood issues that compounds things, and all these things just add up, period. So you have to be deliberate about keeping the diary, making sure that you do deep breathing, you do a lot of focus training at this point. And today we'll be talking about menstrual migraines. Women going through menopause often describe series of continuous intermittent headaches that they get, and these are called menstrual migraines, and they usually cluster around the time of the onset of each menstrual period. So watch out for them. There are treatments for migraine. We treat them just like any typical migraine with non-steroidal anti-inflammatory drugs if you are able to use that, or Tylenol. You need to avoid noises, bright lights, avoid eating chocolates at this time just to help with the migraine headaches. It can be very distressful, but these are things that can be prevented as well. So just look for the triggers of migraine and avoid them. The 11th disciple of menopause is generalized body aches and pain. This can be very, very distressful in women going through menopause. And a lot of times when I ask women going through menopause, describe this pain, it's very vague. It's in the joint, it's in the muscle, it is in the neck, it's in the head. Sometimes it's everywhere, and they cannot even characterize this well. You know, when I say is it sharp or is it dull, is it aching, they say it's everything, it's everywhere. It can be very, very distressful. So I want to encourage you to try and do most of your important activities early in the day, and that way you get to save energy, use energy well. And this 12th disciple of menopause is one that you may not notice, but the woman going through the menopause, she knows about it, and that is thinning of hair, loss of hair, dry skin. At this point, women are losing hair. A lot of the hair around here is going. Men are also losing hair. You can see I'm also losing my hair. But with women going through menopause, They lose a lot of hair, and this is when you see all of them putting on wigs everywhere. So you have to be intentional with your hair at this point. Avoid chemicals, avoid relaxers, avoid braids that pull on your hair. You don't want to put pressure on the hair roots. Grow your hair, do dreadlocks, right? And be intentional about your hair. Wear wigs.